Yeah, my name is Michiel Van Genuchten. I'm in the management team of Vital Health Software. We were founded as a software company about 10 years ago by the Mayo Clinic. It's one of the most famous hospitals in the US and one of the biggest brands in healthcare, and a couple of European IT investors. We started focusing on chronic diseases. And to give you some numbers, I know many of you are in the insurance business. The cost of chronic diseases now represent about 80% of all the healthcare costs in the world. That's one issue where you may worry about as a finance person. There are other issues, which is that the number of chronic patients is rapidly increasing, the number of doctors is not. I don't know if you know what the typical time is that a doctor has available per patient for a visit. That number is somewhere around 6, 7, 8 minutes per visit. And it doesn't matter whether you live in Qatar, Qatar, richest country in the world, it's 6 minutes. In Germany it may be 8, if you're lucky it's 10, it's not going to be more. So with an increasing number of chronic patients, we're going to have less time per visit. And that's where IT comes in. You can use software in a smart way to better help patients, to help them earlier. Another important thing is also to help them outside the hospital. Helping them outside the hospital is better for the patient, it's better for the doctor, it's better for the insurance company, it's better for the society. And the kind of things you can do with software, and I'll show you a little bit about it later, what you can do is come up with better workflows, allow people to work together in teams, with the patient, the doctor, occasionally maybe a surgeon, a physiotherapist, and better workflows, medical rules, so that you have the expertise of the top people available in many places in your network. And that's the kind of things that you can now do with software. The software I show you is in use by a couple of million patients around the world. We support about 100,000 doctors with it. And I think we've done quite a lot already, and we're only at the start. Let me show you how it would work for a typical patient, and I'll show you a little bit short workflow. And by the way, all the software is running in the cloud, so I'm not even sure where this is running now. Okay, so I'm Michiel Van Genuchten. I don't pretend to be a doctor here. I'm not a doctor. And by the way, part of the trick is also, if you can make medical knowledge available, then a lot of the handling of the patient can also be done by people in a call center. One of our customers is the largest insurance company in Argentina. They put together a big call center to proactively take care of their chronically ill customers / patients. And a big part of the trick is that a lot of the interaction is not done by the doctor. Because if you provide the medical knowledge and the medical rules, then also people that are not a doctor can do a lot of the interaction. So I'm not a doctor, but there's a Mr. John Smith that we're going to see now. And the first thing you now see is, let's say, what do we know already about Mr. John Smith? So we know him, he's a chronic patient. A chronic patient means patient for life. So there's always a lot of history about that patient. So there are already a couple of recommendations. The reason he was in there, for those who read it, was he had an elevated glucose level. Doctors like to see this number to be under 55. If you're at 81, you either ate too many ice creams or you have a medical issue. And these are more patient notifications, what happens. So the person interacting with the patient right away has an overview. Then we're going to look at today's visit. Now we delete the draft. So you see, you're guided through a workflow. So this is a follow-up meeting. We've seen this patient before. And let's take a look at his medical history and his lifestyles. And so you see the workflow is built right here. We know that the patient has hypertension. He's a diabetes type 2. And for the rest, he is relatively okay. He said he once a week goes 10 minutes running. That's what he told us. And here, let's see, okay, and he's a former smoker, and shit, what did he do? He started smoking again. New question, okay, how many cigarettes? Let's say 6. And how many years has he been smoking? 0, just started again. And this is the kind of guidance. Somebody at a call center could do this. A doctor can do this while meeting the patients. And again, going back to the 6 minutes, if you have 6 minutes per patient, you have to have done all the administration by the time the patient leaves, because the next patient is there. So that's also where IT can help you, just automatically guide you through those workflows and automatically quickly going through. We can also change all kind of care paths. You see here recommendations. There's some new things showed up. There were some previous things already. And this is a workflow for one person. Let me show you how we can take this to the. Let me show you how we can take this to the population level. Because of course, treating one patient is the responsibility of a doctor, needs to be done well. But if you're responsible for a population, which can be as an insurance company, can be all of your customers, this is interesting. This is data, the real data out of the Netherlands. This is a care group in the Netherlands, which is, let's say, a group of 50 GPs working together to treat chronic patients. In this care group, 85% of the diabetic type 2 patients never sees a hospital. They're treated very well, close to home, by their GP, without a problem, with good medical results. We can show you the scientific papers. The cost of this is, per year, far less than 1 day in a hospital. So chronic diseases can be treated very well, close to the patients, far away from the hospital, at a much lower expense, with a much better result for the patient. So this group, 85% of the patients never sees the hospital. What's interesting here, what you see here, the norm, the protocol says a typical diabetes 2 patient without complications sees the doctor 4 times a year. So this is 4, and then it's 5, 6, 7, 8 visits a year. This is let's say, the glucose level. If you're under 55, if you're under that line, you're kind of okay. If you're over that line, that's a sign that things may go wrong. This is high quality diabetes care. 85% never has complications that force people to the hospital. But what you see here, you can still improve a lot. Where you would expect, let's say, the healthy people to go to the doctor less, and the people that are not stable go to the doctor more often. What you see in this picture is there are a lot of patients that are doing well, they come too often. Why are they coming to the doctor? Maybe to tell how great they're doing, how much they like their doctor, but there's no medical reason for them to be there. You can probably handle that with self-management. Give those people a sensor at home, but guarantee them that they will be tracked by the medical rules of the doctor, so that if their diabetes value goes up 4 days in a row, don't call us, we'll call you. The high-risk patients that you don't like as an insurance company are here. They are the people who are too heavy, no exercise, maybe still smoking, and they don't come to the doctor. And why not? Because the doctors tell them to lose 20 kilos, stop smoking, which is exactly what they cannot do. So what you see here, so with this care group that's already treating 85% of their patients for 250 euros a year, let me give you the number, far less than the cost of 1 day in a hospital. We're now working with them actively, with the doctors. Okay, how can we get people from the top left to the top right, get them down, and back to the bottom left where everybody wants to be? If you see how this is used and how we work with insurance companies, sometimes the insurance company is our customer. Like in Argentina, the insurance company said, hey, there's no health infrastructure, we'll build it. Sometimes in countries, some European countries, typically the insurance company is heavily involved. And there typically the health network is our customer. We're about to start in China with a project. We're one of the biggest insurance companies in China. In China, the number of diabetic patients is about 100 million. The number of cardiovascular patients is about double of that. And there's no first-line GP health infrastructure. So there we work with a medical portal. Interesting, the biggest medical portal in the world, 90 million customers, patients. We work with them and an insurance company to also get this kind of efficient and effective mobile, let's say, healthcare in a country like China. 20 seconds left, thank you.